When students go online to register for classes for the fall semester, they'll see something new. They'll have to provide proof of insurance or they'll be charged $500 to join the university's student health plan for the upcoming academic year. This plan is the university's way of meeting the currently contested federal mandate that all citizens have health insurance. Vice President of Student Life, Jack Hink, explains why.
And I think it's imperative that we as an institution prepare our students that healthcare is something that you really need because it can have a traumatic effect on your life should something go wrong.
The nurse practitioner conducted a survey that showed that 60% of OLLU students are uninsured, and since her office can only provide limited health services, many students go without necessary medical care. Student Christina Pineda is uninsured and has had to go without medical care because she couldn't afford it.
I mean, it's important because I've had little accidents before. It's when you least expect it, and then that's the worst part about it, because you don't have it, and then suddenly this happens to you, and it's hard.
That's the kind of situation the student healthcare plan is designed for, catastrophic events, and that's why it costs much less than the university employee plans that can be hundreds of dollars per month. The student plan is meant to cover major injuries and subsidized health care costs so that students can focus on their education without worrying about paying medical bills.
If a student is not covered and something happens to them and you have a catastrophic accident, you're not going to be coming to school because the medical bills are going to be flying in left and right. And this is to help the student get through that catastrophic situation, take care of the medical conditions, and come back to us.
The school's student health care plan has not yet been finalized, so there are no details as to what exactly the plan will cover. However, the current cost for students is $500 for the academic year, which will be factored into their financial aid award just like other charges. Pineda admits she's interested in the plan, but she worries that she will still not be able to afford it even if it's added into her award.
I think it might be a problem for me because since this is my 4th year and I still need a year and a half, I'm gonna get money deducted from my award or from the money I get from the school. So I think that would be a problem for me and maybe for other students that are still continuing here after 4 years.
Hink emphasizes that the student health care plan is not mandatory, but students will be required to have some form of health care insurance.
The best thing that a student can do is investigate and ensure that the insurance program that they're going to be on, whether it be the university's or whether it be their own, is the best one for them.
Students looking for the best deal will have to decide quickly because the policy is set to go into effect when students begin registering for classes, and registration starts April 23rd. For the Lakefront, I'm Jordan Whitfield.